All right. Good afternoon, good evening, good morning. My name is Emmanuel Adegbola, and I'm so excited to welcome everyone to Keyna Earth Show today. We have a wonderful topic to be discussing, and of course, I am not alone. I'm just the co-host. I have the host, and we also have two VIP panelist guests in the studio with me. So I'm going to be calling them one by one to introduce themselves. We have one all the way from Nigeria. I hope the internet cooperate with her to let her be able to partake and participate in this. So if you are there, Miss Ifeoma, can you go ahead and introduce yourself to our viewers? Over to you, Miss Ifeoma. Yeah, that okay. While she's busy putting herself together, I'm so excited to have our doctor also in the house, Dr. Agbola Fatiregu. Could you please go ahead and introduce yourself to our viewers?
Good afternoon, everybody. My name is Dr. Agbola Fatiregu. I am a practicing pediatrician here in the Dallas Metroplex. Glad to be here with all of you.
Awesome. And of course, I have the host of Keyna Earth Show herself, Dr. Keyna Omneko. Can you go ahead and welcome your guest and introduce today's topic?
Wow, I am Keyna Menokor. I'm a family nurse practitioner here in Dallas, Texas. I am excited for today's topic, and I'm more excited to have Dr. Fatiregu and all our other panelists here today. We will be discussing sickle cell disease. As we know, sickle cell disease is a lifelong disease. It has brought of pain, misery, and agony to many homes, shattering dreams and leaving most victims helpless. It is also discouraging for many young men and women from getting into relationships and getting married. Today, our panelists are here to bring great information that will help you make informed decisions on how to manage this disease, and more importantly, what you need to know before you get into a relationship. So here we are. Stay tuned as we demystify this disease to hopefully bring some support to those that are suffering the disease. Thank you. So while we're waiting for Dr. Emmanuel to reappear, Dr. Fatiragu, could you explain to our audience what is sickle cell disease and how is that different from sickle cell anemia?
Okay. Sickle cell disease is an inherited blood disorder that affects our red blood cells. Normal red blood cells are nice oval, meaning it's round, they flow well. Your red blood cells, just to go backwards a little bit, is what's responsible for carrying oxygen. From the time we breathe, take in a breath, we carry oxygen. The oxygen is carried into our blood, and red blood cells, the role is to deliver oxygen throughout all of our tissues. So for people without sickle cell disease, there's usually no issues. Normal people without sickle cell disease, their red blood cells last about 120 days. People with sickle cell disease, there's a distortion. The blood cells become misshapen into like a crescent shape, almost like a sickle. A sickle is like, it gets its name from the farm tool that looks kind of like a quarter moon. But in any case, they cannot carry the same amount of blood, of oxygen, and they get stuck into our blood vessels. When they get stuck in the blood vessels, you can have a shorter life. It can cause your blood vessels to become occluded. So it can cause issues with our various organs. It can impact the kidneys, impact the intestines, impact the chest. Sickle cell causes a wide range of problems. It impacts, it predisposes the person to have certain infectious diseases that I guess we may talk about later. Sickle cell anemia is roughly the same thing. So if you have sickle cell trait, your body has the genetic material for the genetic information about sickle cell disease, but you may not carry the full-blown disease if you just have the trait. The problem with the trait is, though, there is a potential for passing it on to future generations, so your children, per se. We could talk a lot about about sickle cell disease and everything it causes, but from the moment that you're born with true sickle cell disease up until you're an adulthood, it can impact one's life. But life isn't over per se. There's many things that can be done to make sure that even if you do have full-blown sickle cell disease, you can have a very impactful and lifelong and live a great life in terms of 60, 70, 80.
Wonderful, wonderful, wonderful. I know it's going to be a lot of information to take in. We also have some stories that I believe we'll be using to interject as the host ask you questions. So let's listen to one of these stories of people living with sickle cell, and I believe that will also help us even as we paddle the canoe of today's show.
Cartoons like number one animation. So the man has to be full of energy and precise. I think it's kind of like therapy for me. It makes me feel like I'm normal. Like I can be normal. Music is life. Music is life. My name is Shania. I'm 16 years old. I live in Mason, Mississippi, and I have sickle cell disease.
Even if they don't have a chronic disease, it's hard to be a teenager. They really have to be on top of taking care of their sickle cell disease, in addition to being exposed to the regular world and daily activities of going to school, participating in a sport.
The first time I actually found out she had a disease was when we were at a contest, and I saw her get kind of weak, and we were marching off the field, and I saw her pass out. She's always just like pushed herself, and she's just worked so hard.
Most of our teens, they don't want to be different. They don't want to have to stop and take breaks because it makes them look different or feel different. It is a chronic disease, and it is very vital to their care that they have a place that they can go that understands their disease. St. Jude is one of those places.
St. Jude Children's Research Hospital is primarily known as a place that treats children with cancer.
All right, so that's the story of that lady. You know, at each time they beat the drum, she just feels that they are beating the drum for her, thinking that, okay, she can live a normal life. So I believe that is possible. Is that, doctor?
Yeah, you can absolutely live a normal life. Again, the sickle cell disease is estimated to affect about 100,000 people in the United States, and they're mostly people of color, mainly 1 in 500 every Black or African American has sickle cell disease. 1 in every 36,000 Hispanic American has sickle cell disease. But again, it's not something that you can't adjust to and live with. There's certain clinical interventions that exist to help people live with sickle cell disease. Everything from giving penicillin to a baby who's newly diagnosed with sickle cell, to immunizations to guard against certain diseases that sickle cell disease patients have, to prevention using ordinary folic acid, which isn't very expensive. Folic acid is a vitamin essentially. It can be picked up over the counter, but even your healthcare provider can prescribe it. And it helps your red blood cells. It helps your body make more red blood cells. If we're ever traveling to endemic areas, and the endemic areas are sickle cell, generally sub-Saharan Africa, Mediterranean areas, parts of the Caribbean and India. If we're ever traveling, and our community especially is a group that is international, and travels, they should observe malaria precautions. There's some people or some of our people have the mind, if I was born in Nigeria, why do I need to take malaria precautions? But if you're having kids, especially born in Western parts of the world, they may not have had the exposure that you as parents have. So it's a good idea for malaria prevention. If we do all of those types of things, every once in a while, people with severe cases of sickle cell disease may need blood transfusions. Blood transfusions, basically, you add fresh red blood cells to a patient who may need those because their sickled cells can no longer deliver oxygen effectively. Then there's screening that we may touch on in terms of family counseling. And then what's on the horizon is gene therapy. Gene therapy is a way of targeting the disease, targeting the gene that causes sickle cell disease, and trying to kind of isolate that and prevent. If you can tweak the gene that causes sickle cell, then you prevent the disease from happening in the first place. But it's definitely, as medicine gets more and more knowledgeable, there's therapeutics that are on the way that can help people live productive lives.
Wow. Thank you so much for that information. Before I bring back the host, I just want to say thank you to all our audience, all our viewers. I mean, right now we have over 200 people viewing from different parts of the world. So if you have any question, make sure you type in your questions. And of course, if you have any question whatsoever, please do leave your question. We have other guests also in the house that might want to introduce themselves. Dr. Obina, can you introduce yourself to our viewers? I believe you can hear me, right?
Yes, I can. Good evening.
Good evening.
Yeah, my name is Dr. Obi Obina. I'm the medical director of Schema from Nigeria. I'm also the medical director of Franca Memorial Clinic here in Nigeria. Thank you.
Awesome, awesome. Good to see you. So over to you, Dr. Keyna, as you host your panelist.
All right. Dr. Fatiregun, I know you have touched a little bit about, versus sickle cell, but to a layman, can you dive in a little more of what genetic play a role that genetic factor has to play in having sickle cell disease?
Okay, so if you go back to the history a little bit, about 1,000 years ago, there was really bad strains of malaria, and the way evolution works and natural selection works, it was found that if one particular strain of the hemoglobin chain was sickled, it kind of gave people a way of combating malaria. Over time, natural selection and evolution, you have now this genetic mutation of sickle cell disease. So basically, to keep it as simple as possible, if you have the genetic information about sickle cell in your genome, meaning like you have the sickle cell trait, then if you interact or marry someone else who's also a sickle cell trait, then you have a higher percentage of having offspring with full-blown sickle cell disease. If one parent has full-blown sickle cell disease and then marries someone else who has sickle cell trait, then I believe it's about 50% chance that offspring can have sickle cell disease. If the two individuals merely have the sickle cell trait, then again, it's an autosomal recessive. Again, don't want to get too far in the weeds, but it's an autosomal recessive gene. So two people with a trait, the offspring have a sickle cell trait, meaning you just have the genome. You just have information about sickle cell in your genome. You don't have the disease. If you just have the trait, then the potential offspring has about a 25% chance of having sickle cell disease. So that's how it's passed along. It's not X-linked. It's not carried to. There's some diseases in medicine that are autosomal dominant, and there's some diseases in medicine that's sex-linked. This one is called autosomal recessive, in the sense that there's your dominant genes are the ones that usually take over. So you need two people to have at least a trait to have the disease propagated into the next generation.
Thank you. Dr. Bina, do you have anything to add to? We are discussing sickle cell disease today. Dr. Fatiregu has given us some insight on the difference between sickle cell disease, sickle cell anemia, and how it comes about. What do you have to add?
Well, nothing much. He said quite a lot of things. He said almost everything there. So I just want to talk about the social aspect of sickle cell and stigmatization of sickle cell disease. And back here in Nigeria, we call them warriors. We do not call them sickle cell. We don't just brand them sickle cell disease. We just call them warriors. So I want to encourage people not to stigmatize patients with sickle cell anemia and sickle cell disorder. So he probably has said everything about the pathophysiology. I think probably when we continue in the conversation, we'll have more things to say. Thank you.
Yeah, thank you. Thank you very much. Dr. Fatiregu, go ahead. Dr. Fatiregu, were you wanting to say something?
Yeah, I just wanted to tag along to what Dr. Obina was saying. That was something when I was here. When I go through, when I was trained, we just go through the medical. We don't always go through, not all the time, and we do. Our professors do our best, but we don't always understand all the social impact. And that was one of the things that struck me. Especially being born and raised and trained here in the United States, is that the topic of witchcraft often comes up with sickle cell patients, and that threw me for a loop, to be honest. So because patients are always sick, because the frequent hospitalizations, because they can't always express what's going on as children, they can't always express what's going on within their bodies. What I've learned in kind of looking at more of the social aspect of sickle cell is that in certain countries and certain cultures, they say it's witchcraft that's affecting the child, when in fact it's just a pathophysiological issue. So we have to be cognizant in terms of educating people abroad as well as here that this is not something that there's nothing that made your child evil. There's no curse that affected your child. It's just genetics, unfortunately. Genetics that was designed to help prevent malaria, unfortunately, can cause other problems in terms of sickle cell disease. Also, the shunning aspect too of patients or warriors, as the previous speaker has used the term. Oftentimes they get shunned even after they survive a rough childhood of being a sickler. When it's time for them to marry, they get ostracized almost, because no one wants to marry them because they're afraid of their offspring getting sickle cell disease. So the point is well taken.
Yeah, we are going to dive a little more into the effects, how it affects people, the younger generation, and marriages as well. But before we get to that, how would some that they have sickle cell disease, apart from doing blood work and all of that? Are there any symptoms that they will start feeling before they even try to go to the doctor to know that they might have sickle cell?
Who's that for? Is that for myself or?
Dr. Keyna, you can go ahead and take that question. You're muted.
Signs. Am I muted?
You're good.
Can you hear me now?
Yes.
Okay, there are no specific signs physically that you can say that someone has sickle cell except they do the blood work. Is the blood work actually that can say 100% that a patient has sickle cell disorder? However, there are some features that we can see in a patient, and we say it's most likely that this patient may have sickle cell. One is the conjunctival yellowness of the eyes. The conjunctival jaundice, that's the yellowness of the eyes in the child. If you notice that the child constantly has yellowness of the eyes, that's the conjunctiva, the white part of the eyes, then it's suggestive that that child has sickle cell anemia. Then also there's what we call the frontal bulging of the forehead. The forehead looks a little bulged out. So if you see the frontal bulging, it's suggestive that this child may have sickle cell until proven otherwise when the blood work is done. We also have some form of abdominal distension. The child looks very slim with distended abdomen, as though he has kwashiorkor, maybe down here in Africa for those having kwashiorkor. These are for children that are extremely sick and malnourished. But there are some warriors that we just incidentally find out when they come for their investigations. Maybe they are sick and they present in the hospital and they've been sick over time. So you just do the blood work and find out. Those ones are really healthy. And they actually manifest later in life at about 9 to 10 years. But those of them that are malnourished actually appear a little bit earlier in life. So the yellowness of the eyes, the frontal bulging, loss of skeletal muscles, and the abdominal distension are some physical signs that you may see that are suggestive of sickle cell anemia until proven otherwise, until the blood work is done. Thank you.
All right. Thank you. Dr. Fatih Regula, I know that this particular sickle cell disease from Nigerian aspect is totally different from here, because before, during pregnancy, the parents are screened, and also the child is screened at birth. Can you bring in a US perspective to how it is diagnosed and how people know that they have sickle cell disease?
Sure. So I believe every state in the union, to be honest, has something called a newborn screening program. It's implemented by the state. So when I trained in New York, there was one particular test they did the day the baby goes home on every baby. They screen for dozens of diseases, but sickle cell is one of those. In Texas, where I'm working now, they do something similar, but they do it also both the day the baby goes home as well as at 2 weeks of age. It's supposed to be done. I say supposed to be because a lot of times new moms are given an avalanche of paperwork. And if it's their first baby, I'm sure they don't read everything. But ideally, in an ideal situation, the baby is tested twice in Texas. Once the day the baby goes home. The public knows it best as a PKU test, but it's not just PKU. They test for thyroid, they test for sickle cell, they test for a bunch of other rare diseases. But in Texas, the way it's designed, it's supposed to be a second test is supposed to be done at 2 weeks of age. So I do it frequently in my office, the second test, when I see a newborn, because many times the mom really doesn't understand that she has to do the second test. So in every state in the union, I would say that there's some form of sickle cell screening, both in the newborn period, when we leave the hospital, as well as around 2 weeks of age. From there, most cases are picked up in the United States unless a parent refuses that test. And most of the time, especially in the African American community, I see a lot of people from different parts of the world as well, and you'll see tests that show up as trait. Every once in a while, I'll see a patient that has suspicious for true sickle cell disease. The importance of that is that if we have a patient that comes back with some form of trait, either S trait or C trait, there's other various traits as well. I don't panic the parents. Let's explain it again. All that means is that your child has the genetic information about sickle cell in their genome. It doesn't mean that they have sickle cell disease. And to be honest, people with the trait or patients with the trait can do just about everything that someone without the trait can do. The one exception, I believe there was a football player, North American football player, who couldn't go to Denver, Colorado, because of the high altitude. So I said, unless your child is going to be a professional football player living in Denver, your child is going to be fine. For those patients that come out, and also I tell parents, don't worry about this test, because I like to repeat that test around 1 year of age with their regular routine screening. So if I have a patient that has a positive trait, what I'll do is when I look for is customary in the United States to check for lead exposure as well as anemia, general anemia at 12 months of age. I'll add a third test for those who tested positive for the trait at around between 9 months and 12 months of age. So that's my routine. For those who tested positive for sickle cell disease on the newborn screen, then it's important to hook them up with a pediatric hematologist and then start penicillin. So penicillin can be given even in the newborn period, but it's particularly important for sickle cell disease patients because they're at risk for certain bacterial infections in the newborn period. So it's important that they get prophylaxis with ordinary penicillin, which isn't very expensive.
Okay, thank you very much.
We have a question on our Facebook by Omolara Felicia. It says, is it possible that an SS patient never had symptoms or crisis to even prompt testing? Who wants to take that? Dr. Obi, you want to go first?
All right. It's possible that an SS patient may not have symptoms if the patient is probably very healthy in the early years of his life. Because I have seen a couple of patients who discovered to be an SS patient at about 7-8 years. So for the first 5 to 6 years of the person's life, the child may not have had any crisis. Okay, so it's actually very possible in the early years of the patient's life. But later in life, by the time they begin to get exposed to different environmental hazards and all, they will definitely come down with symptoms.
Dr. Fatiregu, do you have anything to add?
Yeah, I would say anything's possible. True full-blown SS. Well, the first few years, patients retain fetal hemoglobin. So fetal hemoglobin is protective against sickling and crises and things of that nature. So I would say first few years it might be possible. Anything. There's nothing that's in practicing 20 years I've seen. I can't say you can never say never, but it's still important though, because even though you may not have a full-blown crisis, you still are at risk for certain infections that are common in the pediatric age group. So everyone knows about. I think most people in the healthcare industry know about strep. Sickle cell patients are really vulnerable for. It's called encapsulated bacteria called strep. So strep for someone who doesn't have sickle cell or someone who's not necessarily taking prophylaxis might just cause like a minor sore throat and fever. But for a sickler, that can cause infection in the bloodstream and even severe infections in the brain and spinal cord.
Wow, what a wonderful information. Before Dr. Keyna continues to ask the question, let's listen to some of the stories again.
My whole body just went into full-blown pain crisis. And I thought for the very first time, I'm going to die from this disease.
Your own body turning against you.
As if somebody is using a chisel and hammering
with nails and needles poking through the bone.
It's like being lit on fire.
Moi j'étais en fauteuil roulant, je pensais vraiment que j'allais mourir et que j'étais personne, que j'allais jamais rien faire de ma vie.
I actually died at hospital, but I was resuscitated.
I'm 27 years old and I've already had 4 surgeries.
3 months నుంచి నేను పెయిన్ ఉండడం వల్ల వర్క్ చేయలేకపోతున్నా.
They get rid of me because of sickle cell disease. It's so unfair. It's so unfair.
I was told that I should play sports. I just want to be like all my school friends.
Teacher say to me, you cannot do anything.
मेरे को सिकल सेल्स बीमारी की वजह से स्कूल छोड़ना पड़ा और ये मेरा सपना पूरा नहीं हुआ।
दर्द है ये सिर्फ बच्चे को ही नहीं परिवार को भी होता है।
It's not easy for me. It's not easy. I lose everything.
I had another stroke. Since then, I've not been able to talk.
How many patients here have sickle cell disease?
Pelo fato dele ser branco, eles descartaram a possibilidade dele ter falciforme, né?
Because I look fit and healthy, they told me that I can't have sickle cell. I've gone to hospital in crisis. I've been treated as if I'm a drug seeker and been refused treatment.
There are levels and levels of discrimination and stigma where people are even afraid to talk about it.
हमारे मन के दोस्त को पता चली तो साथ में ही
There wasn't any other child at my school who had sickle cell. I really was out on my own.
And I felt ill.
I lost my mom.
If anything happens, she's alone.
The problem is when they don't do the screening, they don't know their status.
Not all the hospitals have sickle cell clinics.
If you don't get good healthcare, your crisis is going to be worse and the outcome is likely to be bad. In the western part of Kenya, most of them are dead by the end of the first decade of life.
We have found that the leading cause of maternal death in Kenya is sickle cell disease.
अपने आप से गिर गया था और मैं उम्मीद हार चुकी थी कि मैं नहीं जिंदा रहूंगी बोलकर जब मैं मरने वाली बच्ची।
My doctor told me, you will never live till 42. I'm 45.
ఈ సికిల్ సెల్ ఉందని ఎక్కువ బాధపడేది కంటే తొందరగా తెలుసుకొని
People are beginning to understand the concept of sickle cell disease.
They can be a predictive factor.
It's not a disability. It's actually a motivating factor.
सिकल सेल्स बीमारी मेरे को रोक नहीं सकता। शादी करने से मैं अच्छा फैमिली बिताना चाहता हूँ।
ये बीमारी से लड़ना चाहिए।
अगर आपको उससे लड़ना है तो आप महान होते हैं।
They're warriors. To be a warrior, you have to be a fighter.
You have to adapt.
You have to learn how to roll with the punches.
Mais dans la tête, c'est le plus important. Si on a le mental, si on a le moral, on peut faire des choses incroyables.
The sickle cell disease. Don't stop me.
Capable de tout faire, vraiment tout faire, tout ce qu'on veut.
उम्मीद नहीं हारी और है ना जॉब पे स्टार्ट करी मैं जॉब जाना जब मेरा हेल्थ थोड़ा अच्छा हुआ तो अभी मैं घर भी देख रही हूँ घर भी नहीं चलाती हूँ अब।
We have not made miracles. Just take care of patients.
Ça donne de l'espoir, on se dit qu'on n'est pas tout seul dans ce combat-là.
I love my disease. My disease frustrates me, but I love it because it's still me.
All right, over to you.
Wow. That was awesome. So I know during the course of this year, you have mentioned some treatments for this disease. So how is it managed? Is there a guideline on, there are medications? What do people need to know? Because it seems like back in Nigeria, I'm not sure if there's any screening, specific screening that goes on, like newborn screening like we have here. And many of our guests are from Nigeria. So is there any guideline on a treatment for sickle cell disease?
All right. Back in here in Nigeria, we don't have those early routine screening, just like doctor said in Texas they have. We don't have those routines, early neonatal screening for our for our neonates. However, the treatment modalities are dependent on the patient and where the patient is and what they can afford. Because back here in Nigeria, almost every treatment is paid out of pocket. So it becomes very difficult for patients to access good medical facilities and good healthcare services. So it's one of the biggest challenges we have down here, because most of the very good services and medications, the plans and everything we're supposed to have for these patients, they are all paid out of the patient's pockets. So there's no plan, there's no very good laid out plan for these patients so that they can get these routine screenings and get proper medications like you have for HIV, hepatitis B, tuberculosis, and the rest of them. They have all those plans for them. Their drugs are free. Their treatments are free. The tests is free. But for sickle cell, no, we've not gotten to that level. I think that's why we are also doing most of these programs coming out on TV and on live broadcasts like this to talk about it, so that the government can actually hear and implement some of these screening tests, treatment modalities, and everything, just like they do for HIV and hepatitis B, to implement that for sickle cell. So we do not have a particular plan for a particular plan and regimen for the sickle cell warriors. However, what we do is patients depends on each patient. So whenever the patient comes, we know the state of the patient. We those that can afford hydroxyurea, we give them hydroxyurea. Those that cannot afford hydroxyurea, then they go on their regular hematinics, their folic acids, take lots of vegetables and treat malaria promptly, take antibiotics when they are infected by the strep infection, just like doctor has already said, and other infections that we are battling with down here in Nigeria. Then take their regular, take lots of water, make sure they are properly hydrated, and we encourage them to take lots of green leafy vegetables and some of the products like soybean milk, which is very helpful for them to help to build up their red blood cells. So that's basically what we do for them here. For those of them that can actually afford medications like the hydroxyurea, we do some tests for them, like the full blood count test. And if they are able to, if their full blood count is well and okay for them to take the hydroxyurea, then they can commence the hydroxyurea. Some of them, if their blood levels are really very low, if they are severely anemic, we encourage them to get blood transfusions and some other medications to make sure that they are fine, especially the pain medications. And we really have a big problem here with addiction to pain medications. Most of our warriors are already addicted to pain medications. So it's a big challenge for us here in Nigeria. Most of them are really already addicted to the pain medication, because these medications are not supposed to be over-the-counter medications like pentazocine, injection pentazocine, tramadol. They are not supposed to be over-the-counter. But I don't know how they get their ways, to get this medication, take them over the counter, take them privately, and they get addicted and they get resistant to most of these pain medications. So I think that's just what we have down here in Nigeria. So we are really trying to use this medium to call out to the government to see what we can do so that we can have a specific plan for sickle cell warriors like we have for those with HIV, hepatitis B, and tuberculosis.
Awesome. We have a question. Thank you so much for sharing, Doctor. We have a question on Facebook by Ronald, and the question says, does blood transfusion have any significant effect on the rate of sickle cell related complications?
So it would have a positive effect, to be honest. So the problem with sickle cells is that they only last 10 days maximum. So again, those who don't have sickle cell, your normal red blood cell lifespan is 120 days. So think of having red blood cells that are supposed to last 120 days only last 10 days. So invariably for full SS patients or full sickle cell disease patients, you're going to have again those sickled cells that cause that stick to blood vessel walls and cause blood to perfusion problems and basic ischemia, parts of your body that just won't get blood because particularly the limbs, ulcers in the limbs, you can even predispose to strokes. So what blood transfusions will do, and they'll give healthy, round, non-sickled cells to the recipient. With every with blood transfusions have risks of their own, obviously, but depending on how reputable the hospital facility is, it's tested for any major diseases like HIV, hepatitis B, things of that, hepatitis C, things of that nature. So those are complications, but I mean, I'm lucky enough to practice in the United States where usually those risks are pretty minimal. I'm not sure how maybe Dr. Obina can speak to the risks of transfusions in Nigeria.
Dr. B, you want to add to what Dr. said?
Yeah. Blood transfusion is very helpful to sickle cell warriors when they have a crisis, because the major function of the red blood cell is to carry nutrients and oxygen to the body. And once you have severe anemia, there's lack of oxygen to the brain, there's lack of oxygen to the other parts of the body. And if some of these sickle red blood cells block the blood supply to the brain, the patient can actually come down with a stroke. So once a patient is anemic, they also have the crisis with oxygen. They are hypoxic. Because they lack oxygen. So just like Dr. Fatirego just said, the lifespan of red blood cell in a sickle patient is 10 days, 10 to 12 days. While that of normal people people without sickle cell anemia is 100 to 120 days. So you can imagine every 10 days, with or without malaria, the red blood cells are destroyed. Like I said, these red blood cells carry oxygen and nutrients to the rest of the body. So with or without malaria, the red blood cells are destroyed. So now when you have malaria in your red blood cells that are destroying red blood cells, whether or not it is 10 days, so it reduces the lifespan of the red blood cells in a warrior. So with blood transfusion, there's an infusion of fresh, healthy red blood cells into the system that helps to send oxygen and nutrients to the entire body and improve circulation. And most times when our warriors are really anemic, when you transfuse them, you get almost an immediate change and response. So blood transfusion is really very helpful to our warriors here when they have this anemic crisis from lack of blood. So when their blood count is very low.
Yeah, I love the way you call them warriors. They are real warriors because they gotta be warriors. So I think the question I want to ask, just like David Obeneko Foundation, deals with cancer, do some screenings. So don't you guys have access to some non-profit organization also that kind of maybe help in the area of what we are discussing? Dr. Obina, Obi?
Yeah, we have SCIP. Yeah, we have SCIP. Yes, can you hear me?
Yes, we can.
Hello?
We can, even though it's freezing. We can hear you.
Can you hear me?
We can.
I hear you.
Okay.
Yes.
Yeah, we have.
Yeah, that's Nigeria factor.
Hello?
We can hear you. Just right on.
Yes, can you hear me?
Yes, right on. I hear you.
Okay, all right. We have some non-profit Okay. We have some non-profit organizations like Schema, where I belong, where I'm the chief medical director. We have staff and other sickle cell NGOs that help with the screening all over the country. So we help with screening and sensitization. So screening and sensitization is actually going on very well here in Nigeria. Sensitization, screening, testing is adult testing is actually going on very well here in Nigeria. We've not started pediatric testing, just like Dr. Fatih Regun said, at birth. I think after I learned that with this discussion, after that, I think I'm going to try to infuse it into our system here in Nigeria, so that at birth we do the testing, because a lot of our warriors have come out because of false positive results to given to their parents, before marriage. So I think actual testing of the child is even more important than testing the parents, because it's the child that is the person that will actually suffer. So that's basically what we're doing here in Nigeria. Yeah.
Yeah, I know our time is fast spent, but before Dr. Keyna takes it over, you made mention of marriage just now. Is there any advice you would like to give to our teenagers, young adults, those that are carriers and they know that okay, they are sickle cell warrior? Now, is there any specific advice you can give to them when it comes to testing, maybe before they take their relationship serious? Because I noticed that some, they are dating, after long, maybe they've dated for 3-4 years, everybody's already aware, maybe when they've now fixed their wedding date as part of possibly maybe church routine or something, they're not okay, let's do testing. They now discover, some will not even discuss it. They will just discover that, okay, they are both SS. So then there will be confusion. Should we continue? Should we call it quit? So what advice would you like to give to those in that category?
Okay, I'm actually a marriage counselor I'm in the medical team.
That's for
yes, that's in Nigeria here. So I'm in the medical team, and we are taking it really serious. So we are going out, talking to people. This is short-term gain. The relationship is just short-term, and if you go ahead, you're going to have long-term pain. So we try to desensitize them. If you are both carriers, excuse me, it doesn't make sense to continue. It doesn't make sense to continue, because you're just going to ruin the life of the child. You're going to ruin your own marriage, because it's difficult for the marriage to survive, especially when the finances are not there. It's difficult to survive. So we go to churches, excuse me, Schema NGO, we go to churches, we go to primary schools, we go to secondary schools, and even nursery schools, and tell them, excuse me,
you want to drink water? Why Dr. Fatih Regun takes it from you? You can take water, then you come back. Don't worry. Let Dr. Fatih Regun.
Yeah, let's have Dr. Fatih Regun's input.
And then just take water.
So yeah, basically, family planning is important. If one knows that they have sickle cell trait, again, it's important because it can they should talk to their healthcare providers about choices that they might be available, and it's probably earlier than later in a relationship, like Pastor said. Basically, more information, the better. If you're going to pursue it, if you're late in the relationship and both individuals are sickle cell trait, then you're going to have just like, premarital counseling is ideal for any time you're going to think about joining or entering a wedding union. So just like you have to talk about in-laws, you have to talk about finances, you have to talk about the health of possible offspring. If you have a mature couple, meaning mature psychologically, then perhaps they talk about contraception, because there is an increased likelihood of having a child with sickle cell disease. And while gene therapy is on the horizon, which could kind of make all this moot, it's not yet available, not yet approved. And even when it gets approved, things trickle down. So Western countries are going to have more options in terms of implementing gene therapy than Nigeria will, or other countries in that sickle cell basin, like India or parts of South America, Caribbean. So you have to have honest discussions with genetic counselors, family planning, along with so that the medicine is intertwined with the social. So it's a tough discussion. That call it quits aspect Dr. Obina mentioned, that's a little harsh, but it's difficult.
I know it's a very, very tough questions, and I know our time is fast spent. Maybe we're going to have part B, the second episode of this session, because then we need to start looking into the role of faith in this. Okay, what if their faith decide to carry it, and they know they are both carriers, and I have a pastor, so let me represent those that are in faith. And you say, you know what, our God is able. We are able to go forward. Then we start looking into the discussion, right, Dr. Obi?
Yeah, I know it can actually is harsh for you to ask them to quit the relationship, but you look at the child, the innocent child that is going to go through all this because of your decision to stay together. I know it can be harsh for now, but tomorrow is going to be better. I just buried 2 of my friends within 1 month, last month. Wow. One was 35 and the other was 33. Their both parents knew they were carriers, and they continued. And today, the young lady is dead and the young man is dead because of different conditions they found themselves. They were really addicted to these painkillers. So they had complications and they passed on. And the mother, this same mother who took the decision, is now devastated. After 35 years of carrying a child from one hospital to the other, now you end up, the child ends up being buried. You understand? I know that there are some persons who actually survive, like the medical director of our NGO, Ifoma Ivejika. She is a excuse me, she's a warrior, and she's 56 years old, and she's still hanging in there very strong. She has a very good family support. I have a couple of other patients who are warriors, and they have good family support, and they are doing very well. What about those without good family support? Now, these young ladies, this young intending couple that you are encouraging to go ahead, what are the options they have? What lies ahead of them tomorrow? Which environment do they find themselves in? We are here in Nigeria. We know what we are facing. Everything we are doing here is almost out of pocket. The economy is not making things better. It's getting worse. And the sources of income, the salaries are not being increased. So how do you want to manage tomorrow?
Well, Doctor, I'm going to come in. I know it's becoming a little bit emotional, so and it's an emotional topic. It's a very tough topic. As I said, we try to keep this to 1 hour because of our audience that, like sometimes they already book that time, and I would like to apologize and also would like to plead with us. I know Dr. Keyna will reach out to us to check our availability, because this is a very, very crucial topic. I'm a pastor. We face it all the time when you see two, like what to talk. It's not what to just say. It's not about them now. It's about somebody or these children coming through there. So, and this is very, 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 very important that we will not need to possibly rush. So even as we begin to tidy up, and there's always what we call the take home that you would like our audience to take home. Before then, let's listen to the last story for today.
It can rob you of your confidence, your self-confidence. Throughout my childhood, pain has been the biggest factor. It's been really bad, and obviously I've had to go into hospital with crisis. A crisis is a prolonged period of pain. If it's gone on for a very long time, that's when I need to go into the hospital and get treated. I was initially admitted, and I was in the hospital for a week. I was discharged. The pain wasn't really controlled, and I had to come again for another few days. That would be the worst. Aside from the pain, it's just the tiredness. I always feel fatigued in school, like staying concentrated in lessons, engaging with conversations with my friends. It's become a huge challenge for me. Last year, I was doing a really important exam that could possibly determine what I'd be doing for the rest of my life. That was a very stressful time. I was ill for quite a lot of it, actually, and I just had to keep on going. It took a lot of mental strength to really get through that period. And I think I'm proud of myself for that.
Awesome. So once again, we want to say very, very big thank you to all our viewers, to all our guests. So as I said, we always want to just drop what is called a take home. If someone that is connected with us since we started has not really taken anything, what would be just that one thing that you want that person to go home? Either the person is a warrior, or a family of a warrior, or just a viewer that might want to use this for somebody. Let me start with Dr. Fatiregun.
Yes. So again, sickle cell disease is not the end of the world. You saw the young lady in the last video. She is getting through it. There's things that we can do in medicine, especially in pediatrics. An ounce of prevention is worth a pound of cure. So for those in Nigeria or even the United States, folic acid isn't very expensive. I think take folic acid to help replenish your red blood cells. Hydroxyurea has been shown to help prevent crises, help prevent pneumonia. Hydroxyurea is excellent. And of course, immunizations against your basic immunizations, but also immunizations against strep. Those types of things will help promote the life of a sickle cell.
Thank you so much, Dr. Obi.
All right, thank you very much. I just want to encourage everyone to please do not stigmatize warriors. Encourage them as much as you can and help them to fight to stay healthy and alive. And I also want to encourage people to please, before you get emotionally involved, make sure you are tested very well. And if you are a carrier and your partner is a carrier, please do not get involved. Please look at this young girl. Look at the kind of pain she's going through. You just imagine yourself going to bring in a child into this world to go through this pain, and you are doing it intentionally. Please, please, and please do not get involved if both of you are carriers, so that we can actually stop this disease, this disorder, and get rid of it from our environment. We can do it. You can do it. Thank you very much.
Wow. Thank you so much, Dr. B and Dr. Fatiregun. I mean, it's a lot to consume, but I believe others have already gotten the information. Thank you so much. And to all our viewers, Thank you. So over to you, Dr. Keyna, as you end today's show.
Wow, what a show. I am very grateful to our two panelists, and we had another panelist who is a warrior that couldn't come on the show. But I'm going to plead with them because we're going to have a part 2 of this. We didn't get to the complications or other options, reproductive options that are available to sickle cell disease patients. So I want to thank our audience. Was a wonderful show, and I hope a lot of you got a lot of information today that you can utilize, to bring some comfort to these debilitating disease and have some hope for the future. And we will be getting back with you because there's going to be definitely a part 2 to this show. Thank you all for listening and watching.